Hello, everybody. Alrighty, welcome to Webinar Wednesday today on September 6th, 2023. My name is Danielle McKnight, event specialist, and I'm thrilled to be with you hosting today. This is our first webinar Wednesday of the fall. I would like to start off by acknowledging that September 30th marks the National Day for Truth and Reconciliation. The day honors the children who never returned home and survivors of residential schools, as well as their families and communities. Public commemoration of the tragic and painful history and ongoing impacts of the residential schools is a vital component of the reconciliation process. Here in Toronto, we acknowledge that we are on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, Métis, and Métis people. Today's webinar is Abstract Submission Guidelines for Potential eHealth Presenters. It is my pleasure to introduce Treasurer Ledgister, eHealth Conference Director. We will have time for Q&A at the end of today's presentation, so please type your questions into the chat box at any point. Thank you all for being here today, and I'd like to pass the screen over to you, Treasurer.
Thank you, Danielle. I'll start to share. See if you can see my screen. Danielle, yeah, okay, perfect. I can move forward. Wonderful. So thank you, Danielle. Great day to everyone. Welcome to the Abstract Submission Guidelines for Potential eHealth Presenters webinar. My name is Treasurer D. Ledgister, and I'm the Director of eHealth Conference and Trade Shows for eHealth 2024. It is my pleasure to spend the next 45 minutes with you sharing the process of how to write and submit a winning abstract for eHealth 2024. I'll thank everyone who's joined us online today because I know that time is the most vital resource. So I'd like to also thank Digital Health Canada for providing this Webinar Wednesday platform for us to connect about eHealth. And I do hope that you find it informative and helpful. We have a lot of information to cover, and we will have time for Q&A at the end. So feel free to type your questions in the chat. As Danielle mentioned, she will monitor those questions. And if they're not addressed during the webinar, they'll definitely be addressed during the Q&A. Also, we are recording this session, and we will post the recording and a PDF of the slides at the eHealthConference.com website under the eHealth 2024 Call for Abstracts page. So let's talk about what we're going to discuss today. So during this webinar, for the next 45 minutes, we'll talk about what is eHealth, what we're looking for a presentation. I'll share some helpful tips, give you some information on how to get started. Then we're going to dive right into a guided tour of the abstract submission form, look at some resources that you can utilize, and then open up the floor to Q&A. Okay, so what is eHealth? Well, eHealth brings together the top minds and talent from the Canadian digital health community that are attendees, panelists, and presenters. It pretty much is the optimal event for sharing ideas, expertise, successes, and challenges with peers across Canada and beyond. It's been held annually in Toronto or Vancouver since 2000, and it attracts up to 1,500 attendees in person. So eHealth was held virtually in 2020, in 2021, and then again in 2022. But we were beyond excited to be back in person in Toronto, May the 28th and 30th, that just passed at Beanfield, and we had about 1,300 in attendance. It was remarkable. There's an excellent video, actually, I should highlight for you that captures all of the greatness that was eHealth this past May, and it's on the eHealth YouTube page. The attendees that we attract at the eHealth include executives, information and technology professionals, virtual health professionals, government and health policymakers, clinicians, patient partners and caregivers, students and academics, and even emerging professionals. We will be heading to Vancouver, May the 26th and 28th of next year, and we'll be hosting the event at the Park, Vancouver. So what are we looking for in a presentation? Well, as abstract writers, what you're trying to do is pretty much write a story. some sort of information that will give a dialogue about a project or the event with which your health system has the potential to change the face and focus of the healthcare delivery in Canada. The submissions should describe an initiative, technology, a process, or a delivery model. And these are all great in different areas that you can actually touch on. We want to be able to confront some of the challenges that we're going through in the digital healthcare in Canada. We'd also like to find a way that looks at all of healthcare settings across the continuum of care. So we can look at acute care, patient referrals and discharges into community care, and increase studies of home care projects. Long-term care continues to be challenging, and we always find different ways to optimize, so please share those submissions. We encourage submissions from First Nations health communities and BIPOC health communities. They face individual challenges themselves, but they've also experienced successes from various regional deployments within Canada that we can share within those communities. Mental health is also a significant area that we'd like to find out more ways to apply e-health solutions and deployments. And telehealth or virtual health is also an excellent receptor for what's happening in the health industry. So in order to present at eHealth, you need to be mindful of two key dates. The first one being that we're opening the call for abstracts this upcoming Monday, September the 11th. And then we will be closing it on Friday, October the 20th at 11:59 Pacific time. We'd like to get into some of the details of what the abstract submission process and presentations are at eHealth. We actually have 8 conference topics and tracks this year that the abstract submitter can actually decide what they'd like to apply for or submit towards when they are making their submission. The first one is artificial intelligence in healthcare, where you're exploring the applications of AI and Gen AI, machine learning in healthcare, from administration to patient education and diagnosis to personalized medicine. The second topic is connected care and interoperability, where you're highlighting data and language standardization, data sharing, policy alignment, and shared governance initiatives that support a connected healthcare system. The third topic is digital health equity and access, where you're focusing on strategies to address the digital divide and ensure equitable access to digital health technologies and services. The fourth topic is digital technology in healthcare human resources. This track will explore how digital technology can help address healthcare human resources shortages and optimize workforce management. The fifth track is health data management, security, and privacy, addressing best practices for collecting, analyzing, and securing health data while you're ensuring privacy and balancing data sharing priorities. The sixth track is patient engagement and empowerment, where you can explore approaches to enhance patient engagement, promote shared decision-making, and empower individuals in managing their own healthcare. The seventh topic is technology solutions for mental health, focusing on mental health care delivery, technologies, and mental health innovations, resources, and tools. And the eighth track is related to virtual care, telemonitoring, and remote patient care, where you're examining advancements in virtual and remote care technology and program implementation in the impact of healthcare accessibility. So all of this information is available online under the submission guidelines on the call for abstract page of the eHealth website. There are 4 different types of presentations that we're exploring, and on a high level, they are the panel, the oral presentation, rapid fire, and e-poster. All of them are different means to get your idea, project, and thoughts across, and we'll spend just a few minutes here to talk about what these each entail. So the first is the panel presentation, and it's about 30 minutes per session, where you will present a concept or an idea, and there's a maximum of 3 presenters permitted for each accepted panel presentation. The 30 minutes could include Q&A. So typically there would be 2 to 3 speakers presenting different views of a project, or they could just be speaking about the challenges. But the idea is that the panel presentation would have some sort of insight and have a little bit of a discussion with the audience and bring forward some sort of wins from 3 different perspectives, for which is why we allow up to 3 presenters for panels. Oral presentations actually form the basis for most of our presentations at eHealth. They're 15-minute presentations that roll through a PowerPoint slide deck, and you're able to tell a story and present your thoughts on a project and implementation that you're working on. Inside of this, we give the presenter the option of having a Q&A period, or they can spend the full 15 minutes doing a straight oral presentation. There's a maximum of 2 presenters permitted for each accepted oral presentation. The third presentation format is a little different, and we introduced it a few years ago. It's called the rapid fire presentation, and they are done in 7 minutes total, where you're allowed to answer 3 questions on 3 slides. The 3 slides are very defined in structure, and the first one is where you will actually present the healthcare challenge. The second slide will outline the existing barriers, and then the third one will present what the solutions or the outcome is. There's a maximum of 1 presenter permitted for a rapid fire. With the rapid fire, you may be combined with other presenters in a similar subject matter so that all 3 presentations that are related to this topic would then have the opportunity to present back to back, and then a moderator would then suggest some sort of debate and audience Q&A between the 3 presentations. It's a little bit of a different presentation format, but it's very exciting and energetic, and we've been getting a lot of great feedback about it, so which is why we've brought it back this year. Finally, the 4th type of presentation is the e-poster, which allows for a 5-minute presentation on a project or case study that informs or advises the delegates of key findings or lessons learned. The audience that attends an e-poster will have a couple of minutes to engage in Q&A at the end. But again, it's a very clear defined electronic poster format where the successful e-poster author will be provided with a template that they can use and upload to the conference portal ahead of the conference. All 4 presentation types will be done at eHealth in individual breakout rooms. So in this venue in Vancouver, they're actually in separate breakout rooms, and they'll be done during the concurrent sessions located on the conference floor. So some helpful tips on what to do when you're preparing your abstract. Let's talk about what to actually include in the body. So as we talked about before, we're looking for new ideas that you've seen or learned from other healthcare studies or from different disciplines and approaches that bring e-health solutions or demonstrate an application. Again, you're encouraged to discuss the methods, the technologies, the processes, and the abilities to move these projects forward. We're looking for new ideas that resonate within your environment and that can contribute to teachings or finding a way to educate and demystify the Canadian healthcare space. We consider abstracts in the planning phase and any that are in a new initiative that may be developing in your area. So an example of this could be perhaps you're a hospital or a regional setting where they're part of an improved project plan that you're working on, and there's some defined plans of action that will happen over the next 6 months. Understanding that you may not have quantifiable results in September when you're applying to submit your abstract, but by the time April arrives, you'll be able to share a status update of what's going on in the project. So we do welcome those as well if something's new and in development, as long as you can address an important topic. We are giving you a platform to share where you live on a day-to-day basis, your experiences, your challenges, and we want you to share some of these results that can also be quantifiable. So for example, if you have a project where you've been able to decrease the wait time by 10%, or you've been able to improve patient satisfaction by 25%, all of these are really great and great examples of abstracts that you can submit. The main point here is that you should also focus on the next steps that are developing in the next phase of your deployment of your project. So speak about the evolution as well and what the outcomes are for the process that you're describing. We encourage you to find a way that is clear and concise when you're explaining your 500-word abstract. It should be very straightforward and engaging. So let's get started on where you would go to submit your abstract. I'll take a few minutes now to actually walk through where you'll find this information online, provide you with information on guidelines and a downloadable template form that you can use. So again, all of this information is located on the eHealth website under the Submitted Abstract drop-down menu, which should appear shortly after this webinar. The menu will lead you to the Submit an Abstract page, and then you can read the instructions there on what's required. When you're ready, click on the link leading you to the submission form. And again, that link will be available as of Monday. Please again, remember that you have until Friday, October the 20th at 11:59 to submit your abstract. The abstract will be blind reviewed by a few different members from our abstract review committee. They are a wonderful group of individuals that are made up of some patient partners that are also involved in this review committee. And they're also involved in the program build overall. We always want to make sure that we have a patient-centered view of what's going on. So when these reviews are happening, it's a review by patients as well as people within our professionals within our community. The login page for the submissions. Here we go. So the following slides will showcase what will actually look like once you're in Submittable in the abstract submission system. When you're ready to begin the abstract process, you'll see that on the left side of this screen on the slide this is for the new submitters. You'll be guided through creating a new account where you'll fill in some mandatory fields. And upon completion of setting up the account, you'll receive an account confirmation email that allows you to log in and complete your submissions. When you access the login through the confirmation email, you'll be able to return back to the system on your main dashboard. And this is where all of your submissions will appear, whether they're in draft form or you've submitted or you've deleted, everything there is within that system. You will have the opportunity to save a draft and log back in, which is on the right side of the screen, is the welcome back screen. And that's where you, again, will access this screen when you want to log back in for any submissions that are in draft. There's 7 sections that I'm going to take you through right now that go through the steps for each page of the submission process. First off, we're going to ask for your contact details. And even though this is very standard information, it's actually very important because this is how we get in touch with you. So please remember that any fields that have a red asterisk are considered required. And reminder that this is a blind review process. So these contact details that you're providing to us will not be shared with the abstract reviewers. Right off the top, we're going to ask for you to select your tracks and topics. So you have the opportunity to go through those 8 main topics that we discussed earlier. And again, reminder that at the very bottom, you can get the descriptions on that link that's at the very bottom of the list. And that will take you to more details on each track. Please note that even though you may select your conference track, you can select more than one here, all that you feel apply, that the program committee may change the conference track if they feel that it fits more into another track more suitable. So just keep that in mind. We'll then ask you to title your submission as well as come up with a summary. Please know that these words that you use are limited in the sense that it's because we use these to post to the website as well as to the conference app. So the fields that we're using do have limited characters. We're asking for 15 words for the presentation title, and they should be descriptive and attention-getting. And then there's a 50-word summary that will also summarize your abstract in 1 or 2 sentences, but you have about 50 words to complete your summary. And again, this is how your presentation title and summary will appear on the conference website and in the conference app. And the program committee may adjust a few words if necessary, if we need to shorten it in any way before it's published. Now let's get into the meaty part where we talk about the actual details and the body of the abstract. So the number one reminder I need to make sure everyone understands is that it's a maximum of 500 words. 500 words are all encompassing, and that there will be no other text or information that will be included or reviewed by the reviewers past the 500 word limit. So the easiest way for you to keep mind of where you are is to consider the 4 considerations that I'm going to share with you on how to build your abstract, because these will help keep the abstract focused and concise. The first one would be under purpose and objectives. The purpose and objectives is where you would start to tell us what your project is all about. Then we're asking for you to move into the second part, which is around methodology and approach. So describe how you approached your challenge. The third section of your submission should include findings and results. What were the results and the conclusion or implementations and recommendations? And lastly, the findings and results, what the results were. And lastly, the conclusions, implementations, and recommendations. So what did you learn? What would you like to share? What was the outcome? Another tip to keep in mind so that you don't go over your 500-word limit is in the bottom right corner, there is an accumulated count of the 500 words. Last thing I should point out for you, which is extremely important, is that because this is a blind review process and review, even though they don't have your contact details, the abstract reviewers will receive the full body of the abstract. So you are encouraged to delete any identifying information, like the project name or your institution or organization name from the abstract to ensure that it remains a blind review. You'll then have the opportunity to identify and indicate your preferred presentation type. And again, the 4 options are panel, oral, rapid fire, and e-poster. And again, if you need to know the reminders or what those are, or descriptions, you can click on the link right before the question. You also have the opportunity in question number 6 to select an alternate presentation type if you feel that your presentation can go more than one way. And we offer this flexibility because even as reviewers, we may find that you went for an oral presentation, but we think it could be paired up better with a panel. And then we may come back to you and suggest that you look at presenting it as a panel, or vice versa. It could go another way. So we leave room for adjustments as the overall program is being developed. We'd like to know about the presenter. And so this is also very critical because it lets us know if you're submitting the abstract on behalf of yourself, where you plan on presenting it, or if you are submitting it on behalf of another presenter, like a boss or a colleague that will be a lead or primary presenter. Please note that there's no limit to the number of authors that have contributed to the program or the project that you're submitting. However, there can only be one lead primary presenter, even if you're submitting an abstract for a panel. Okay, so there's only one primary presenter, and this one primary presenter per submission will receive a reduced fee conference registration. Any additional presenters will pay the full conference registration fee. So again, with your panel presentation and your orals, you can have more than one. Your oral, you can have up to 2 presenters. The one primary will receive a reduced conference fee. Any additionals will pay the full registration fee. If you are a panel, however, you will receive a reduced conference fee for all 3 panelists, okay? And the last screen, questions 8 and 9, is where you'll actually identify who those additional presenters are. So all your presenters must be identified in your abstract submission. You can identify the optional additional oral presenter and the panelists in questions 8 and 9. Okay. Before we conclude out the submission form, the last step is the opportunity to either save it as a draft or to submit the form when you're ready. And you'll notice that as you review the form, if you decide to save the draft or to submit it, if there's anything that's missing, it'll be outlined by a red box. Once you update those fields or resolve those issues, then you'll be able to save it or come back later to your draft and submit it. And when you're ready to submit, you simply click Submit Form. So when do you find out the results? Okay, these are important dates. Well, I should share with you that the successful submitters will be notified the week of December the 4th. And then they will be notified by email where they will be advised that they've been accepted to present. All selected presenters must confirm their acceptance within submittable by December 15th. All selected presenters. So everyone that you've identified will be presenting that has been accepted, all must accept. Okay, so kindly keep in mind that the abstract submitters, keep in mind that the titles and presentations may be adjusted, but we do require for you to accept presenting your submission by December the 15th. And you can visit the website for more information and updates as they come about. We do have a couple of resources that you can familiarize yourself with. And the first one being obviously the main eHealth conference website, which is ehealthconference.com. Please take note that on this website, you'll be able to find all of the information that we discussed today. Also, the link to submit your abstract, which becomes active on Monday, September the 11th. You'll also be able to download a submission template that if you wanted to practice a little bit prior to going through the submission process, there's a template there that you can download. What I would suggest is that you get an early start on your submission, because every year we have a massive avalanche of people that submit on the closing date. And we want to ensure that we have the opportunity to answer any technical issues or questions that you have within the appropriate timeline, because the submission window will close October 20th at midnight or 11:59. If you do have any questions about the submission technical support team or questions about the review process, you can reach out to the eHealth speaker and abstract management team. The address is speakers@ehealthconference.com. Or you can reach out to me directly or anybody within the eHealth team. We're certainly here to assist you in the process. I am putting up this slide because it does include some key dates, and I'm encouraging everyone to take note. We want to make sure that we share the full date lineup so that abstract submitters are aware of the obligations if they're a successful presenter. So again, we open on September the 11th and it closes on October the 20th. Right after October 20th occurs, the abstract review committee will start the review process. This takes place throughout the whole month of November. And once they wrap up at the end of November, we'll send out the notifications, which will happen the first week of December. As I mentioned prior, all presenters must accept by December the 15th. And then the program committee will spend the month of January going through all of these successful submissions and categorizing them into the applicable tracks and setting up the program. Registration will open on January the 8th, and all selected successful presenters that have accepted must register by February the 29th. Again, a reminder, one primary presenter per submission will receive a reduced conference registration fee. Additional presenters will pay the full registration fee. Those are the optional oral presenters. And if you're in panel presentation, up to 3 panelists, the maximum number of panelists, will receive the reduced conference registration fee. All speakers are responsible for hotel and travel expenses. The call for speaker headshots and biographies will close at the end of March 29th. And that's when we will be publishing the official program, which will be April 1st for the concurrent program on the website. And then presentations for the speakers that are using a presentation for their concurrent session should submit it by April the 26th. And then it is during eHealth that you'll be presenting again during the concurrent sessions that occur on the Monday and Tuesday of eHealth. So these are the key dates that you should be aware of as an abstract submitter and potential presenter. So before we conclude the webinar and open up the Q&A for anyone that has questions, I do want to quickly summarize the top 10 tips to make sure that you have a successful abstract submission. The first one is tell us a story. Tell us why you started working on the project, define some of your results, and have a clear understanding for us for what your experience was and what the outcome was. So be very, very clear when you're telling your story. Create a flow. Please remember that you are writing a story, and what would you want to read if you were an abstract reviewer? Take it from that angle. Is there a beginning, a midpoint, an end, a conclusion? Is it exciting? Have you talked about the future? All of those things. Show your work. If you've got stats to back it up, please do. Describe your processes, highlight key objectives, focuses, activities. Stats are always great, so include those. Tell us your next steps. So we'd like for you to put together a series of steps that define what's impacted your organization, what's allowed you to move forward, what you've implemented, any sort of success, as well as challenges, because we also want to learn about the other side, right? How your work has impacted pretty much eHealth. Give us something new. Be original. Is it innovative in technology and eHealth focus? Tell us how and why. The sixth tip I want to share with you is the fact that it should align with one of the conference tracks. There's 8 that you can select from this year, and we want to make sure it aligns with one of those. Seventh, is to make sure that you sound interesting. Be very, very interesting when you submit your submission. The abstracts, there's lots that they're being reviewing, and how does yours stand out? Come up with a great title and summary. And again, at the end, be clear and concise and focus. Ask someone else to proofread your submission before you submit it, also for clarity. And the last tip, of course, is no vendor sales pitches. We do have an exhibit space at eHealth where you'll have an opportunity to connect with your vendors as clients. And so we do ask that there are no sales pitches, and that we leave that for the exhibit floor. Okay, I think that covers it. So are there any questions or comments that I haven't addressed? Danielle, I'm not sure if you are available to open up the Q&A at this point.
Treasurer, we did have a few late joiners, so they're just wondering if you can reiterate where you can find the recording and the slides.
Yes, they will be at the eHealth website under the drop-down menu, submit an abstract. They'll have the recording there as well as the PowerPoint. We will upload both of those once they've been edited, not edited, but saved and downloaded to upload. Any other questions, Danielle?
Question, do we have access to last year's presentations or videos?
Yes, if you actually attended last year's, if you log into the eHealth website, there is a link under the virtual library to access those videos and presentations. Again, if you were an attendee of last year, you would be able to access that virtual library.
We have one that is, how can someone become one of the abstract reviewers?
Excellent question. On the website, there is an opportunity to put your name forward as an abstract reviewer. If you go to the Digital Health Canada website, under volunteer opportunities, there's an option there for you to raise your hand and submit an application to volunteer at eHealth. Many opportunities at eHealth are listed there. So it could be to review an abstract, to be a part of the program committee, to be a moderator at eHealth, or to be a general volunteer within eHealth as an ambassador on the floor, directionals. There's many opportunities there. So you can access that at the Digital Health Canada website under volunteer opportunities.
All righty. We have a question that is, what is the expected registration fee? To go with that, do graduate students benefit from discounted rates?
Excellent questions. So yes, we do have a student registration fee, and that is available to students that would provide backup of their school registration. So it either is showing a current year that they're enrolled in the program that they're in, and once we receive that, we could then extend the student discount. The registration fee is a reduced registration fee. It's not the full registration fee, and it's usually less than the early bird registration fee. And so those details will be shared in December prior to the accepting of the abstract, so that speakers are aware of what the reduced registration fee will be.
Again, if you have any questions, please type them into either the chat box or the Q&A function.
Any more questions then, Danny?
I do see a raised hand.
Okay. Keep in mind as well, folks, you can send emails through to speakers@ehealthconference.com if you have additional questions outside of today's webinar. Did you get that last one, Danny?
Yeah, I'm going to allow to talk, just so you're aware, Treasurer.
Okay.
We have 2 raised hands. All righty. All righty.
Are they able to unmute themselves and speak?
Malene, I'm sorry if I've mispronounced your name. You are available to speak if you'd like to unmute.
Eileen, are you able to unmute yourself? Okay. Well, Mylene, perhaps you can send an email to us then if your question wasn't addressed during the webinar. Again, you can send the email to speakers@ehealthconference.com, and it's e-healthconference.com. So Danielle, is it okay if we close the webinar now? Or if there aren't any other questions, I just want to thank everyone for joining us, and also want to thank Digital Health Canada for hosting this webinar Wednesday. I hope that you did find it informative and that I answered all of your questions. Again, reach out to us at any time at speakers at e-healthconference.com, or visit the website at ehealthconference.com, and under submit an abstract is where you'll find information about what we discussed today. So over to you, Danielle.
Amazing. So I do have a quick poll for everybody. I want to thank you again, Treasure, and what an amazing webinar. So if you don't mind, I'm going to launch a poll. If you could give us we're just asking for you to give us a satisfaction rating for this webinar today. Amazing. All righty. Thank you all so much. I'm going to end the poll now. And I would like to also bring forward that we have a number of fall events lined up coast to coast. More information can be found on our website. And finally, we have been in the process of launching our community platform. I encourage all members to log in and join or start a discussion. All Webinar Wednesday recordings are now located in the community platform. Thank you all again and have a wonderful day.
Goodbye, everyone.